Doctors of Reddit. What's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? Story 1. Doctor here. It is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be chipping in. For more generic conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor as they can prescribe drugs or tests for me. That would be questionable for me to do myself. Story 2. Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter, I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that'll miss something. Or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since, on myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know. Or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with it, he patients. BC, he can be sure I understand the medical pros and cons. Well, once I'm given a basic explanation. Story 3, doctor. Here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do, I usually just STFU, especially if it's a field of medicine I have no idea about, like, say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly, what you probably have is X. So take this, and if it doesn't get better, then we can do ABC. Story 4. I was sat in a consultation between 2 doctors, with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know. Story 5. My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community for stuff like getting ultrasounds, etc. Then yes, they do discuss stuff like it's a group project. Story 6. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand, and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of my aunt is a nurse, and she said I need a whole-body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. Story 7. It depends on what I'm going in for. As a background, I am an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g., labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Story 8. I don't get involved in the management. I let the doctor seeing me lead that, unless they miss something huge and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. Story 9, doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and that time I had strep a year and a half ago, that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. Story 10. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first, in his cancer treatment, he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, She reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. Story 11. I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. Story 12. Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything, so if I or they get like the flu, they just write a prescription. If they need specialists, they usually tell them they are doctors and they get better treatment like skipping lines or whatever, or they know each other already, so it's chill. I'm sorry, this kind of sounds spoiled, but it's my experience. Story 13. My mom is a nurse and never tells the doctors what she does for a living. It's so they'll speak to her not as a nurse but as a patient. Even though she can understand what they're saying when they use their medical jargon, she doesn't want them to be overly comfortable using the jargon while treating her. Story 14. Obligatory. Not a doctor, but spouse of a doctor. I thought I might have a ganglion cyst in my wrist because I could feel something inside that was causing pain when I moved my wrist, so I scheduled an app with an orthopedic surgeon hand specialist. I had my husband come along interventional radiologist in case there were questions I wouldn't have thought of asking, or something I needed more explanation on later. The ortho hand surgeon was friendly and used layman terms with me, but technical jargon with my husband. It was funny to hear the switch between your wrist bone tendons and blah blah, anterior blah blah, medial blah, whatever he said to my husband. At one point, they did an ultrasound on my wrist to determine if it might be a cyst or if I should get a more detailed MRI. And the surgeon asked my husband if he wanted to take over the ultrasound since my husband trained in diagnostic radiology as well, and he totally did. Weird to have your husband moving the ultrasound wand and pointing to random blobs of static. They both agreed it was a cyst, even though it looked like a whole lot of static and nothingness to me. So it was interesting to see my husband defer to the surgeon for his specialty and vice versa. Edit. Just remembered that time we took our cat in for an x-ray because she was developing arthritis, and we weren't sure how severe it was or if her bones were deteriorating. My husband actually took her x-ray in and had an attending in radiology read it, and they were both convinced our cat had bone spurs or little bone growths around her spine near her hip. He was about 80 convinced that our cat's spine was absolutely wrecked. The vet wasn't worried and said that cat bones just look like that, and it wasn't hurting her and was nothing to worry about. He ended up doing some research on feline anatomy to make sure our very knowledgeable vet wasn't just talking out of her. She wasn't. Anyway, moral of the story is that he went to med school to study human anatomy, not feline anatomy, so he had to learn to take a step back and defer to the expert. Story 15. I try to act like any other patient. Medical people can very much sabotage their own care by taking shortcuts or perhaps declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless because I know that they are. But I do go see my regular doctor for problems that really bother me or for routine exams like anyone else. It can be weirdly stressful to be the doctor or the patient in this kind of interaction. I've learned to not let it bother me when I am the doctor seeing other doctors. It can be harmful to the doctor as a patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. Story 16. I know I'm not the intended target, but I'm an RN case manager for a primary care clinic, and going as a patient into my primary provider's office is funny. But generally, for me, I've found I lose all sense of medical knowledge when I or my kids are the patients maybe out of panic. So I have called the triage advice RN for my kids, a job I do on a daily basis. And if my provider asks if I have any diagnostic requests for my own medical care, I always tell her, "You're the doctor. I trust your judgment on how much or how little she wants to order." Story 17. My grandpa was a cardiologist, and he's the worst at knowing when to go to the doctor. As he got older, he would get cardiac arrhythmia, but keeps saying that everything is fine and he doesn't need to get checked. Story 18. I always go to someone who don't know me, and I wouldn't say that I'm a doctor as well. On the other hand, my SO is a doctor too, and whenever we feel something we do Discuss it like a group project in which he always refused any treatment until his symptoms got to the very worst. Story 19. It's not rare for a doctor to self-diagnose and just go to a clinic to get someone to confirm it so they can get prescriptions. But you're not supposed to be diagnosing yourself and should be acting like any other patient. Describe symptoms and let them decide what you have for themselves. Story 20. Doctor here. Like someone else said, if I'm seeing a specialist of a particular field, then I'm unlikely to have anywhere near as much knowledge as them, so I would consult with them just like any other patient. If it's something more general and I'm seeing a GP, for example, I will tell them I'm a doctor so that they don't go into lengthy layman's explanations, but generally will try to have a normal doctor-patient relationship. I might throw in an opinion on what I think, but ultimately I try to shut up and respect that they are a professional and not tell them how to do their job. It's hard to be objective too when the patient is yourself or a family member. Having someone give their unbiased opinion is often more useful than self-diagnosing, or at least might add some more knowledge or insight that you may not have yourself. Story 21. Had a relative who was an old-fashioned veterinarian and probably the worst patient because of it. This guy would argue with his doctors about his prescriptions and then order the meds through the vet pharmacy because they were significantly cheaper. Which makes sense, I guess. Why pay $50 for a particular med when he can source the exact same thing for $5? But still, it looked kind of funny when he was in his 80s, hobbling around with heart meds that had "for dogs only" in big print on the bottle. Edit clarify veterinarian. Story 22. The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The rad once, for example, thinks and speaks differently than the ortho-surgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured. Story 23. So in 2 words, it's awful. I've been in as a med student where during the examination I was taught and quizzed about what I thought the problem was, and now 2 years post-qualification I still hate it. In training, you tend to move around a lot, which means little to no continuity with your own healthcare. So I've tried a few approaches. Sometimes I don't say I'm a doctor at all unless I'm specifically asked, and I just give them a really obvious textbook history as to what's going on so that they can't misdiagnose me. Other times I've done this and they've not done what I was after. So we got into an awkward argument and had to get the national guidelines up from the internet. Now that I've settled a little, my doctor knows me, and generally will let me tell them what bloods etc. I want, or the diagnosis if I have an idea. Then we'll agree on what to prescribe or future management, which is amazing. Hope this helps satisfy your curiosity. Story 24. Forensic pathologist here. I keep my mouth shut and let my doctor. I have a pulse, so I am not the expert here. Doctors that self-doctor are scary and arrogant. IMHO. Story 25. I saw a doctor waiting, then get called in from the waiting room of the dermatology office like a regular patient. Never saw anything like that before or since though. I doubt they have to wait. Story 26. As an ER DDAR, when I go to my PCP, all decisions are made in tandem, and I do have more input on my treatment plan than a layperson. But I second what others have said when I'm seeing another physician like a specialist. I am more capable at making informed decisions than a layperson, but will always defer to their experience and knowledge. 2 examples. One had a PCP that said jokingly to a medical student in front of me, "How the could he even sue me? He's a doctor." Promptly found a new PCP. It's okay to not like a doctor. Even doctors dislike other doctors. 2. I'm a doctor with literally tens of thousands of hours of experience and knowledge, saving people's lives, and even I know that I don't know 0.1 of what Fauci knows. Wear your mask, it's not a debate doctors are having, just morons. Story 27. Not a doctor, but I'm finishing my MD degree this year. Yay. Just wanted to say that you don't have to be a healthcare worker or a physician for your healthcare to be seen as a group project between you and your physician. Medicine is inherently collaborative, and if you ever have questions about what or why a treatment is being given, or what or how you were diagnosed, you should always ask. And if they refuse to give you reasonable answers outside of BC, I said, So then you should be asking for second opinions on your project. Just because there's someone spearheading the endeavor doesn't mean you should let yourself be apathetic to your care. That's a dangerous level of trust for anyone. You wouldn't trust one controller on your collab projects in high school, and things always go better when everyone puts in their part. Story 28. Greatest doctor call of all time. First, paramedic here, not doctor. Call for chest pain. Side of the road. Guy pulled over to call 911. Not local, just passing through. While my basic is slapping leads on him getting some history, guy is obviously well-educated, knows his stuff, and just speaks the lingo. I run a 12 lead. It's bad. Not end of days, just, hey, let's get the cath lab wound up and drive really fast. It's also a little odd. So I decide to flip it. 15 lead, flip it again, do a right side. Whole time we are making tracks to the ER. Guy asks about nitro, and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him. Hand them over while I'm calling in my report. He thanks me, say right it's anterior, etc. And he's going to need XYZ bypass, etc. Freaking cardiologist. Coolest, most laid-back PT ever. Having a freaking heart attack, and starts explaining to me about the surgical process he's about to be under. Story 29, doctor here. 90% of the time I don't even tell them I am doctor. They are experts in their own field. So I always respect their knowledge base and listen just like I am a regular person. Unless it's my wife, who is a doctor also. Then I don't listen. Ever. That's what she said. Story 30. Neurologist here. I always assume a rare, worst-case scenario when it comes to me or my loved ones. I always rely on doctors. Healthcare has become so specialized that it's not possible to know everything outside your specialty. It's always good to ask for help. Having said that, I'm a terrible patient. Story 31. I'm a med student. When I see a new doc and they know I'm in med school, it's like I'm being let in on a secret behind-the-scenes world. And I love it. I've had some talk to me more like a peer than a patient, explaining differential diagnoses and why they do things on a more detailed level than they would for a non-med patient. It's an impressive balance of education and patient relationship. I appreciate docs that are welcoming to the next generation, and you see that at their core, physicians are educators. It's humbling to be a patient and reminds me what it feels like to be in my future patient's shoes. Story 32. My boyfriend is a doctor and he has a yearly physical aptee and is dreading it because he has to get a prostate exam. He has given many, but boy is he dreading it. Story 33. This is actually a really good question. I'm very interested to see the results. Maybe the patient-doctor self-diagnoses and then has another doctor check them out as well just to be sure? Story 34. Doc here. I will share my experiences even though some folks might find issues with it. I won't try and butter any of it up. There's a few differences. Most notably, access. If I want to see a subspecialist, I text or call them and I'm in their clinic the next morning. No waiting, no referral, usually not billed and often not even documented. If I have questions after the appointment, I usually send them a text and get an answer pretty quickly. When I see other docs as patients, they generally get in much quicker and have much more access to follow-up and direct communication than other non-physician patients. In the actual visit, things are different. I generally know the format docs like to hear info in, so tend to present my case in that format. Things generally move a lot quicker. Because I have at least some knowledge going in, generally the treating doc asks me for my opinion. Another aspect is sometimes we don't get standard of care, both for good and bad. An example I had is when I had a surgery a couple years back, the standard would have been to wait it out and see if things improved naturally. Instead, I got an MRI that day was in the OR in a matter of hours. I also didn't follow the typical rehab protocol such as physical therapy, because based on my field, I already was equipped to provide my own therapy. It's strange because you are blending aspects of patient-doctor, professional, and often personal relationships into a single visit. The same doc I am being seen by now probably might have met me for dinner and drinks a week ago. Story 35. Before my brain tumor Parkinson's. Had co-workers, most of them are my friends or known associates of co-workers. I usually always know what's wrong with me. I don't know if it's the knowledge, or if I just know myself and my body. I'll usually get them for a second opinion or just in case. And in some rare cases, we'd have a disagreement on what the tests and imaging results is. My psychologist, a professor, I usually pay him to go into his lecture, because I love psychology, always thinks I'm wrong with what I think about my mental state. Then, when another psychologist or even himself tests them, I usually get the win. During my brain tumor and Parkinson's, I recently got diagnosed with Parkinson's likely due to the tumor malignant in my noggin. I didn't know it, but it was obvious. I had a bad short-term memory, my hands had tremors. I had severe insomnia, to the point I couldn't sleep for days straight, and then only to get a few hours in. I was really fatigued and felt like I was carrying myself like a corpse. I felt anxious and had a lot of panic attacks. I felt physically depressed. My ankylosing spondylitis arthritis on the spine felt worse. I got an MRI and the results came in. The neurosurgeon in my hospital was, I considered, friend, and we kinda got closer before the planned surgery. After surgery, turned out to be worse. My existing symptoms were less there, but I had new stuff. I stuttered like Jimmy from South Park. I can't read easily when the stuff is close. I couldn't use my legs since I have little sensations on them. I kept on pausing and I had a severely noticeable bad reaction time. Seeing my coworkers treat me as a patient is a bit sad for me. Story 36. Most doctors I know, myself included, say that doctors are the worst patients. And I think the reason for that is threefold. One, we are usually very resistant to actually go to the doctor. I mean, why should I? I know what he's going to say and I know what I need to do. I'm not wasting my time, which is absolutely untrue. We can't know everything, and when it comes to our own health, we're usually dismissive and don't pay much attention to it. And most of the time, we're just too busy and are scared to actually go and find out something we don't want to, which is actually one of the hallmarks of a difficult patient too. When we do go to the doctor, at least, in my experience, we, more often than not, already thought about our own diagnosis and the treatment we need, which forces the other doctor to either go through a sometimes demanding work of changing our mind and do an adequate investigation, as we would suggest to our own patients, or to just accept our self-diagnosis right away and just go on with it to avoid some sort of disagreement, especially if you go to a doctor that already knows you from work or med school. It's usually wisest to avoid doing that. 3. The third reason is actually some sort of consequence of the first two. I've seen lots of doctors that only decide to go looking for help when their health problem has reached a very advanced state, usually due to denial, and especially when it's a mental health issue, which is very common around doctors and other healthcare providers, which potentially makes the actual problem way more difficult to treat, and the patient doctor themselves way more fragile. So, to sum up, if you're a doctor and you're reading this, please remember that you're still human and that you're susceptible to all of the diseases you treat every day, and sometimes even more susceptible than everyone else. When you became a doctor, you chose a life of helping others, and thus you must remember how important it is to reach out for help in the first place. Story 37. Subspecialty surgeon reporting in. In general, most docs have a basic understanding of general medicine and can have a collaborative discussion with their primary doc. When it comes to more nuanced issues involving referrals and consults, an informed discussion can still be had. One of the most crucial aspects of being a good doctor and surgeon is knowing what you don't know. Just like for any of my own patients, I will have a discussion but ultimately trust the other subspecialist to practice good evidence-based medicine in their particular field of training. Story 38. I try not to tell them that I'm a doctor. I'm a very anxious patient. I just know too much about the terrible diagnoses which can change your life in an instant and have anxiety around my mortality. It's easier if they don't treat me like a knowledgeable professional, but like the irrationally fearful person that I am. Story 39. My first husband was a cardiologist. An internship. He had bleeding gums and bruising and had his own blood work done. The results came back while he was in the middle of seeing patients, leukemia. He never did see the patients who were waiting for him. I don't know what the office staff told them that day. The next day, we were at MD Anderson. It was surreal. He presented his own history to the oncologist. There wasn't anything else for the doctor to ask. Nothing else to say, really. The diagnosis was obvious, and we all knew it sucked. About treatment. MD Anderson was great, and they treated him like a partner. Story 40. I've had to have a few doctor's appointments since starting residency. I've been enjoying acting like I know nothing about medicine. That way I can get a good feel for the provider. Because in all reality, if a physician, PA, NP, whatever, knows they are about to treat another provider, they tend to act more on their A game. But just like for my own patients, I'd hope I'd be getting the most honest care out the box without having any type of status tied to it. Story 41. I had a skin condition and saw a dermatologist. I spoke to her in shorthand. She did the same. She started explaining a biopsy. I stopped her and said, "Do it." 30-minute appointment took about 5 minutes. Story 42. I'm not a doctor, but my mother is a registered nurse postpartum physician in the US. She actively tries to avoid mentioning her career because during cancer treatment, some of her doctors treated her more like a nurse than a woman dealing with breast cancer. During her diagnosis of a secondary cancer, her oncologist had to be reminded that she was someone dealing with a potentially terminal diagnosis. Story 43. MS3 medical student and my dad is a pulm ICU doc. Growing up, I only ever went to the pediatrician until age 11 to get the standard PEDS vaccines. Otherwise, I've never went to see a different doctor. If I ever got sick, my dad would just diagnose it, write a script, and have mom pick it up. Physical exams for sports, university, etc. were just signed off at home as normal. My dad has been practicing for 25 years, and he has never actually scheduled a doctor's appointment. If he ever had an issue, then he would just write a script for himself. If it was something that he couldn't do himself, i.e., drain a pilonidal cyst on his LOL true story, he would just have his surgeon buddy come to the house and do a ID in the living room for a bottle of whiskey as barter. Has definitely his own doctor. Story 44. My specialty is the eyes. I pretend I know nothing when I go in for regular physicals, etc. I like it when my GP uses their experience more than what I picked up in a classroom. On a side note, other doctors are my worst patients. Bunch of know-it-alls who could not be more incorrect literally every time. Ego is at least they are happy when I am done with them. But the palm to foreheads are heavy. Story 45. He who acts as his own doctor has a fool for a patient. Osler. I still treat myself for the majority of illness, though TBH I knock on don't really have any conditions. I'm also an ER doctor, so that may be different for other specialities. When I've had injuries ACL, I think it just helps the other doctor to communicate in our language, which usually makes things quicker. If my family is sick, I usually assist in translating but try to not step on the other doctor's toes unless I think something is awry. Story 46. A dentist here. Well, considering just inside my field, yeah, I have to see another dentist for checkups and work done if that's necessary. No other choice for us, really. I haven't needed any big work on my own teeth, but if so, I'd surely talk it through like a project with my dentist and consider my different options, pros and cons. However, the thought that another person is drilling in my teeth makes me feel paranoid. You never really know how skilled they are with their hands until the job is done, and I just have to trust my choice in dentist. Much respect and love for my patents who trust me with their health. What an honor it really is. Story 47. Unrelated, but a good buddy of mine is a doctor in a small town in rural America, where he knows most of the other medical professionals. Anyway, he got an STD, didn't want to go to any of his colleagues. So he self-diagnosed, wrote himself a prescription, overdosed, then went to hospital. He is fine now, and we joke about it. Not all doctors are smart. Story 48. My mom's a doctor. She has to go to her own appointments because it's illegal for her to write her own prescriptions, but she doesn't a ton of self-diagnoses. I guarantee she argues with what's actually wrong with her to her doctors. She acts like she's in denial about all of her health issues, so I'm sure she's the group project slacker. Edit, she's an internal medicine practitioner. Story 49. It depends. Many colleagues hate treating other colleagues because they feel under pressure or scrutinized. I've had a couple of encounters where I've been treated rather gruffly. LOL. Smaller stuff I take care of myself. Sometimes I phone up friends or colleagues to ask for a referral or if they can recommend someone. I'm not an expert on anything outside of my area of expertise. Usually I just make an appointment like everyone else, especially since I've moved to public healthcare governance and can't pester my colleagues at the hospital directly anymore, which only worked for small stuff as well. Everything else has to go through official channels. But then again, I live in a country with evil socialized commie healthcare and have no additional private insurance, so I often just have the same waiting times and treatment possibilities like everyone else. I can buy most medicines without prescription, but I then have to pay for them out of pocket, which I sometimes do, just to save myself the hassle of an appointment. I've had a couple benefits, of course, the largest being that I understand what's going on. But that's not really always a benefit, to be honest. I'm not hypochondriac, but if you very precisely know what catastrophic stuff might be in store for you, that's dreadful. Story 50. My wife is an OB-GYN. She picked which of her partners she wanted to see for prenatal care and for her delivery. She couldn't deliver herself. She had a colleague when she trained who elected to not be under full anesthesia, so she could observe another doctor perform a procedure on her. Sometimes I'm surprised about how focused my wife's training is in OB-GYN and how she doesn't know some things that would generally be applicable to me or our daughter. While she covered the basics in med school, it's been a few years and it's outside of her wheelhouse. We have good relationships with several other doctors who we see. It's much better for them to diagnose and prescribe things. While she has prescription privileges, it's frowned upon to prescribe to family. There are also certain drugs that would trigger all sorts of problems if she were to prescribe them herself. Insurance can be picky about paying for things too, if there isn't a record leading up to or necessitating a procedure. And for all you people not masking up, I can assure you that you don't want an OB-GYN just back from maternity leave trying to run your ventilator. Let her deliver babies and don't force healthcare workers out of their specialties because you're too selfish to think of others. Story 51. I'm not a doctor. I'm not a nurse. I'm not a surgical tech or first assistant or PA. What I am is a central sterile tech. This means I clean and sterilize surgical instruments. I have a pretty wide, comprehensive knowledge of surgical instruments and their functions. I do not know anything about the surgeries they are used in beyond some vascular surgery because my best friend is a surgical first assistant in the vascular field, and she has explained a lot of it to me. For some reason, going into most doctor's appointments when they find out I work in a surgery-adjacent field, they assume I know a lot about medicine. I do not. I self-admittedly do not. I know basic things, slightly more than a layperson would know. I know nothing about microbiology besides how to murder it in a variety of ways. I know nothing about anatomy aside from what I've learned about the vascular system because of my friend. I know surgery only in the capacity that I know how long, on average, surgical procedures commonly done in my particular hospital take. Want to know how long a typical hip replacement takes? I'm here for you, along as I know which doctor is performing it. I've gone into multiple doctors' offices and emergency rooms and even surgeries with the expectation that I know what is going on, and I don't. I really don't. It's to the point that I went into a sinus surgery under the impression based on my experience and the way the surgery was described to me, believing that it would be a short, maybe hour-and-a-half surgery. That's how long my hip replacement took. Hour and a half. This surgery took nearly 6 hours. It was by far the most difficult and painful surgery I have had. But nobody told me because I work surgery adjacent, and everyone assumed I would just know. Things like that. It's a very weird experience.